Again, we are going to discuss amyloidosis in diseases of immune system. Amyloidosis is basically buildup of amyloid protein. And what is amyloid? Amyloid is a heterogeneous group of fibrillary proteins that aggregate into an insoluble cross beta-plated sheet configuration, and these fibrillary proteins are deposited extracellularly, and they are resistant to catabolism or degradation, and that results in pressure effects and organ damage as a result of these deposition of extracellular fibrillary proteins. There are 20 different kinds of proteins, but 3 are more important. One of them is AL, amyloid light chain, AA, non-immunoglobulin protein, and A beta, which is deposited in Alzheimer's disease. Now, blood vessels are the first site where the amyloid protein is deposited. Other than that are kidneys, spleen, liver, and amyloidosis is defined as a condition in which extracellular deposition of protein aggregates occurs, and they form insoluble fibrils called amyloid. Approximately 95% of the amyloid material consists of fibrillary proteins, and the remaining non-fibril component are various glycoproteins. Now, pathogenesis of amyloidosis. At least there are 30 different proteins that can aggregate to form non-branching fibrils, that each formed of intertwined polypeptides into a beta-plated sheet conformation. Deposition of these proteins may result from, number one, it could be they produce in an excess amount, so they are prone to malformed and to aggregate, and mutations take place in certain proteins, and these mutated proteins misform or can fold improperly, and they tend to aggregate extracellularly. It could be defective or incomplete proteolytic degradation of extracellular proteins. Amyloid deposits cause tissue injury, and they impair the normal function by causing pressure effects on the cells and tissues, and without initiating an inflammatory response against them. 3 most common forms of amyloid are AL, amyloid light chain. Amyloid is basically made up of complete immunoglobulin light chain, and it occurs derived from plasma cells and are associated with plasma cell tumors such as multiple myeloma. More common is the lambda light chain. Deposition occurs more common than the kappa. AA, amyloid associated amyloid, is derived by proteolysis from a larger precursor protein in blood called serum amyloid protein, which is synthesized from the liver and is associated with chronic inflammatory conditions like tuberculosis, in which they tend to deposit it in various organs. Beta amyloid protein. A beta is derived basically from proteolysis from a much larger transmembrane protein, which is called amyloid precursor protein, and it tends to deposit it in cerebral arteries and plaques in amyloidosis. This flowchart shows the pathogenesis of amyloidosis. Like native folded protein, it's like leads to either it's produced in an excess amount or certain mutation take place into an misfolded proteins in that aggregate in monomers or non-branching fibrils that give rise to beta-plated sheet configuration, and these fibrils get deposited extracellularly in various tissue and organs. Production of, as we had discussed, there could be abnormal amount of protein that produce in excess amount, like it could be acquired mutations like monoclonal B lymphocyte proliferation, which leads to plasma cells, and these abnormal plasma cells in plasma cell tumors like multiple myeloma, especially immunoglobulin light chain lambda, it gave rise to AL protein. Chronic inflammatory conditions like tuberculosis leads to macrophage activation, which causes recruitment of certain cytokines like interleukin 1 and 6, and that leads from liver cells that causes serum amyloid associated protein, which is synthesized from the liver cells to further degradation, and there is limited proteolysis of this protein, and this protein get deposited in various organs as AA, serum associated protein. Production of normal amount of mutant protein, transthyretin, like inherited mutations leads to certain mutations in transthyretin protein, and it start aggregating a misfolded protein get deposited in different tissue organs, ATRTR protein, such as in hearts. Now, how diagnosis of amyloid is primarily done on histopathological evidence of amyloid in a biopsy tissue, where amyloid appears as amorphous eosinophilic hyaline extracellular substance with H&E stain. Now, special stains like Congo red stain is done for confirmation, which gives this pink or red color to amyloid in tissues. And this, when Congo red stain is visualized under a polarized microscope, it gives apple green birefringence. Thus, it differentiates amyloid from other hyaline proteins like collagen and fibrin. Now, most common sites of biopsies are kidney. When renal manifestations are present, renal biopsy is the most common that is done for diagnosis of amyloidosis. Other than that, rectal or gingival tissues in suspected systemic amyloidosis. An aspiration cytology of abdominal fat stained with Congo red stain can be done for systemic amyloidosis, and confirmation is done by electron microscopy, which reveals amorphous, non-oriented thin fibrils. This is the histologic picture of which shows deposition of amyloid in and around the blood vessels. Now, this is the Congo red stain, and this without polarized microscopy, which gives this red and pink color to the amyloid, and when it's visualized under the microscope and under the polarized microscope, it gives this apple green birefringence. ISC immunohistochemistry can be done for amyloidosis, and this is the electron microscopy, which shows these non-branching thin fibrils of amyloid protein. Amyloidosis amyloid can be deposited in spleen. In spleen, it has two forms. It can present as sago spleen, in which amyloid deposits are limited to the follicles, and Lardasius spleen, in which amyloid is deposited in walls of splenic sinusoids and spares the follicles. Amyloidosis of the kidney. Now, this is the Congo red stain, which shows this pink, orange, red amyloid protein deposited in the glomerular capillary network, and when it is visualized under polarized microscope, it gives this apple green birefringence to the amyloid. Amyloidosis of liver. A section of liver, as we had seen before in the previous diagram, like stained with Congo red, reveals pink-red deposits of amyloid in the walls of blood vessels and around sinusoids, and under polarized microscope this gives apple green birefringence. Cerebral amyloidosis. Small cerebral artery branch in the cortex shows extensive orange-red Congo stain, indicative of amyloid deposition. And adrenal amyloidosis. Congo red stain deposits of amyloid in adrenal. Cardiac amyloidosis. Myocardium stained with Congo red stain in case of amyloidosis under polarized light has an apple green birefringence. Clinically, the patient presents with features of weight loss, fatigue, renal failure, congestive heart failure, carpal tunnel syndrome, and peripheral neuropathy. Organs that are most commonly affected are heart, liver, and kidneys, whereas GIT and lung involvement are usually asymptomatic. Prognosis is poor for generalized amyloidosis, and individuals with myeloma-associated amyloidosis are even poor, whereas individuals with reactive systemic amyloidosis in certain infectious conditions, chronic inflammatory conditions, have better outcome depending upon control of the underlying condition. Amyloid associations. Amyloidosis is subdivided broadly into systemic, generalized, and localized tissue-specific forms, and is further classified on the basis of predisposing conditions. Primary amyloidosis, like immunocyte dyscrasias, plasma cell dyscrasias, multiple myelomas, in which malignant plasma cells synthesize abnormal quantities of a single immunoglobulin or light chain that can be detected in urine as Bence-Jones proteins and M-spike on serum protein electrophoresis. These AL type of systemic amyloidosis leads to monoclonal light chains deposition. Chronic granulomatous diseases like tuberculosis and certain chronic infections that leads to, like rheumatoid arthritis, scleroderma, bronchiectasis, chronic osteomyelitis, and these leads to AA type of amyloid deposition. Hemodialysis. Hemodialysis-associated amyloidosis, like 60 to 80% of these patients are affected due to deposition of amyloid in joints, synovium, and tendon sheaths, as beta-2 microglobulin is not filtered by normal dialysis membranes. Hereditary and familial. This includes rare conditions or entities and are confined to specific locations. For example, familial Mediterranean fever that is caused by overproduction of interleukin-1. Localized amyloidosis. Localized means that it is specific or localized to a single organ or a tissue. Like localized form of AL is a immunocyte-derived amyloid with associated plasma cell infiltrate, nodular deposits, and it can occur in lung, skin, bladder, and tongue. Endocrine amyloidosis occur in association with hormone synthesis, like certain carcinomas, medullary carcinoma of thyroid, that make procalcitonin and that deposit as amyloid fibrils. And aging, like amyloid of aging, it occurs in 8 to 9 decade and most commonly due to deposition of non-mutant transthyretin protein, and especially in heart, that leads to congestive cardiomyopathy.